love that. So why do you choose M-FAT over PRP? Cost effectiveness, same for BMAC. We do a ton of PRP, so we would need a protocol to drive recommendations.
Yeah, absolutely. So I use PRP a lot. And so where I use PRP, well, let's go start off with osteoarthritis. PRP has great data in mild to moderate osteoarthritis. Usually 80% success rate using that in those patients. Once we get to stage three, that efficacy starts to drop. I usually see it somewhere between 50 to 60% successful. Once we get to stage four, that bone on bone, I usually see it's about 30% successful. So it's usually my stage threes and my stage fours. I'm talking to the patients about using fat or I'm using bone marrow because even in stage three and stage four, we're typically getting a 75 to 80% success rate when using M-FAT or BMAC for those patients. I also use fat for larger rotator cuff tears, larger glute tendon tears because of its viscosity. So when you have these large tears, there's a gap that's there. PRP is not going to fill that gap. You need something to serve as a matrix to allow these cells to bridge over to heal and to kind of fill in. And fat does an amazing job for those larger rotator cuff tears, glute tendon tears. And then lastly, I like to use kind of fat in my thick fusiform Achilles tendons. So those really thick tendons that I've PRP'd them, they get some improvement. They feel a little bit better, but the size of the Achilles tendon usually doesn't come down with just PRP alone. And we know that when you have an Achilles tendon that's larger than 1 centimeter, that it's at a higher risk for rupture. So I find that fat actually helps to kind of reverse that and allow that to actually decrease in size. So those are some of the areas that I prefer to do kind of my fat